59-year-old Chris WorthingtonBarnes loves to push himself physically, but symptoms of an enlarged prostate were holding him back.
I've got a very active lifestyle. I love to exercise, I love to challenge myself, and you really can't do that if you got to stop and find a bathroom every 20-25 minutes or so.
His symptoms also became an inconvenience and sometimes an embarrassment at work and when he traveled.
If you're in a professional setting, you're in meetings, 30 minutes is a meeting. You're uncomfortable, your quality of life is terrible. You can't drive long distances. No matter how hard you try to get everything out, you just don't. It just collapses it off and you just can't empty out the bladder.
Starting at about age 45, enlargement of the prostate is fairly common in men, and as the prostate gets bigger, it can squeeze the urethra, as shown here, and block urine flow.
The bladder starts to work harder and harder against that prostate, which leads to a lot of what we call storage symptoms. Men urinating much more frequently, at nighttime having to wake up more often.
Chris tried medication but didn't like the side effects, and he didn't want traditional surgery, which is more invasive, requires a longer recovery, and has its own side effects. Dr. Ferroni recommended a relatively new outpatient procedure called Urolift.
Urolift is a procedure that for the majority of men we do in the clinic. And the idea behind a Urolift is it's a series of implants that are put into the prostate for men that have significant symptoms from prostate obstruction. That traditionally we would have to do surgery to remove that tissue to open up the prostate.
A few small implants are placed to lift and hold the prostate out of the way, allowing normal urine flow from the bladder. There are no incisions involved.
The procedure itself takes about 10 to 15 minutes, and to get the same result as a traditional surgery that takes an hour or two, that requires hospitalization, general anesthesia, the nice part about a Urolift is it's done completely under local anesthesia in the clinic. Some men can even drive home afterwards.
Dr. Ferroni says most patients are able to return to normal activities within a week or two.
Now I can go through my workouts. I work out almost daily, and I can continue to challenge myself in different ways without having to think about, is there a bathroom within minutes of where I'm at, should the need arise. So again, the quality of life is just phenomenal.
To learn more about Urolift, visit mercycare.org/urology.